Hello, my name is Michael West. I'm Senior Visiting Fellow at the King's Fund in London and Professor of Organisational Psychology at Lancaster University, and I'm pleased to share with you some thoughts in this really critical time about how we look after others, those we work with. Central to supporting patients, carers, our colleagues, everyone around us during this time is compassion. What is compassion? Compassion has four behavioural elements to it. The first is, if someone is in distress, of being present with them, of attending to them, listening to them with fascination, as Nancy Klein says. Second is understanding the causes of their pain, their distress, their fear, their anxiety. Third is having an empathic response, feeling at some level their pain without being overwhelmed by it, and that gives us the motivation for the fourth element of compassion, which is intending to help or serve the other person. And what we know about people's stress at work, particularly during prolonged periods of very high demands, which is what we are now facing, is that colleagues around make the most enormous difference to people's well-being. So we see that teamwork has an enormous impact on people's well-being. If we work in a team that meets regularly and is relatively cohesive, stress levels are 50% lower. And fundamental to that effect is the social support that our colleagues provide us. So at this time, it's really important that all of us have the intent to be compassionate towards those we work with now and in the coming weeks and months, being positive to each other, being supportive. Humour is a great source of support in the workplace when it's a gentle humour rather than an unpleasant humour. And civility, just being civil to each other, even to people we don't know particularly well. It's so important to be civil and kind and friendly. And small gestures make an enormous difference. I remember last year talking to a doctor from an A&E department who was telling me she had just the most awful day and felt really at breaking point. And then somebody who she didn't know, a nurse, came up to her and offered her a cup of tea. And she said it just changed the whole nature of her day. So it's really important that we, during this period, are vigilant about being kind to each other, to those we work with, whether they're part of our team or not. There will be moments of irritation, of frustration, of real pain. And it's more important now than ever that we retain that sense of compassion with each other, just practicing those four behaviours of listening, understanding, empathizing and helping, that we check in with each other, with our colleagues in our teams, that we maybe even develop a kind of buddying system where we have one particular person who we look out for and who looks out for us. And that recognizing that compassion, when it's expressed, has an impact not just on the receiver, but it has an impact on the person showing compassion. So we know from studies of clinicians internationally that when clinicians are compassionate, it has the effect of reducing their anxiety, their stress, the likelihood that they will feel depression. And we know that, fascinatingly, if we ask people to, over a 2-week period, show an act of kindness to somebody every day, it has an impact not just on those they interact with and are kind to, but it has an impact on their well-being over that time. And interestingly, the ripples spread out. What the studies show is that when we are kind to somebody, some small act of kindness or civility, that those people don't necessarily reciprocate, but they go on to be kind to others in turn. So the ripples of kindness and compassion spread out. So now more than ever, it's really important that we all support each other, that we remain connected, that we build that sense of belonging and caring and compassion and love within our workplaces. Compassion and self-compassion are core to our ability as health and care workers to get us all through this crisis and to come out the other end stronger, better, wiser, not just with an even more profoundly good health system, but a better society overall. Thank you for listening.